Welcome back, y'all. This is Liz from Oak Brook Medical Group here today to discuss joint injections. When we talk about joint injections, we're talking about the gel injections that can consist of either Suparts, Genvisc, or Orthovisc. What those products do in the joint, specifically the knee joint or shoulders. Today we're going to talk about the knee. It goes in and it cushions the joint, meaning we have space in our knee, and due to arthritis or injuries that patients can have, it can decrease that space. Putting the gel in will provide some cushion and improvement within the joint space after a series of 5 injections. Orthovisc is a series of 4, and the Suparts and Genvisc are a series of 5, and they're done once a week into the knee. Over here on my tray, I have everything set up that you would need to do a knee injection. There's gauze, there's my ultrasound machine here that we use to look at the joint space to make sure that we're getting it into the proper area on the knee. There is an alcohol wipe and a Preventic wipe to clean the knee joint. And then I have, this is actually what Genvisc looks like. It comes in a pre-packaged box with a syringe. All you do is you have to apply or attach a 22 gauge 1.5-inch needle to the end of the syringe. And then the next thing you do is you're gonna ask your patient to pull up their pant leg if they're not wearing shorts. And you're going to take your ultrasound probe and you're going to apply it onto the actual skin of the knee. That way you can actually look at the patella and the knee joint. I will then mark on the screen here on the keyboard whether it will be right or left patella. Clean off the ultrasound gel, clean the knee with the wipe and the Preventic wipe. I have an epichloride numbing spray to numb the knee. That way they don't really feel much of a needle. The patients will feel some pressure as you're injecting the fluid into the knee. My patients tolerate that really well. I've had a couple patients that even after the first injection, they can see a difference. What do I mean? What do the patients see is they have less pain going up and down the stairs, bending. I had a patient that was able to shovel snow without pain later on in the day, because with these injections, there's not really any restrictions the patients have to do. What I recommend for the patient is to kind of work it in, move their knee a little bit throughout the day after they get the injection. They can either ice or heat the knee. But they don't really have to limit their activity. Actually, it's better if they keep that knee and that leg moving. That way it gets that gel, all the way into the knee joint and cushioned in there.